You feel a little more tired than usual. Breathing's heavier than it should be after walking across the room. You've got a dry cough that just won't go away. But there's no fever, no chest pain. And you figure, it's just your age, or allergies, maybe the weather. But what if it's something else, something more serious, something that looks quiet on the outside, but can cause life-threatening damage on the inside? Pneumonia doesn't always look dramatic, especially in older adults. Sometimes it doesn't come with a high fever or that deep rattling cough you expect from a lung infection. Sometimes it sneaks in quietly and does its damage before anyone catches it. For seniors, pneumonia can show up as confusion, or a sudden drop in energy, a loss of appetite, even a change in blood pressure or breathing speed, long before anyone hears a wheeze. And the scariest part? It can be fatal. Even a mild case can lead to complications that weaken your body, trigger hospitalization, or spark a downward spiral that's hard to recover from. Most people don't know this, but pneumonia is one of the top causes of death from infection in people over 65. But here's what matters most. Pneumonia isn't just a disease. It's a signal. It tells us the body is vulnerable, that something in the immune system, lungs, or environment has left a door open. And that means there's something we can do, not just to treat it when it hits, but to lower the chances it shows up in the first place. If you're over 60, or someone you love is, this isn't a scare tactic. It's a wake-up call. You see, the lungs don't age quietly. Over time, they become less elastic. They lose strength. Cough reflexes weaken. And your ability to clear mucus, bacteria, or viruses from the respiratory tree, it slows down. It's not because you did something wrong. It's just part of aging. But it means your body has to work harder to keep your airways clear and your immune defenses strong. Especially if you live in a shared space, have chronic health issues, or are recovering from surgery or illness. And that's why pneumonia becomes such a threat. Because even a simple cold can settle into the lungs and turn serious, especially if you're not drinking enough, moving enough, or eating foods that help your body fight inflammation and infection. So let's talk about what pneumonia really is, and why it's such a quiet danger in older adults. Pneumonia is an infection that targets the lungs, specifically the tiny air sacs that should be full of air, but instead fill with fluid and inflammation. That fluid blocks oxygen. It makes breathing harder, and it opens the door to more bacteria, more stress, and more complications. In younger people, pneumonia often shows up fast and hard, with fever, chest pain, coughing, and trouble breathing. But in older adults, it's different. The signs are often subtle, and that's what makes it dangerous. You might feel more tired. You might get confused. You might breathe faster or feel like you can't catch your breath after doing very little. And instead of spiking a fever, your temperature might actually go down. So it's not always obvious, not to you, not to family, and sometimes not even to the doctor right away. That's why awareness is everything. Knowing what to look for. And more importantly, knowing what you can do to reduce your risk before it starts. Because while pneumonia can be dangerous, even deadly, it's also something you can fight through prevention. And the way you eat, move, and monitor your body, those choices matter more than you think. Pneumonia doesn't affect everyone the same way. And if you're over 60, the risk is not only higher, it's easier to miss when it begins. You might not feel sick at all until things get serious. So why are older adults more vulnerable to pneumonia in the first place? It starts with the immune system. As we age, the immune response naturally weakens. Your body isn't broken, but the defenses that once kicked in fast and hard now take longer to activate. That means viruses and bacteria have more time to spread before your body can mount a proper defense. It's called immune aging, or immunosenescence. And it's something everyone goes through. Then there are the other health issues that often come with age. Conditions like heart disease, diabetes, COPD, even Parkinson's or arthritis. They don't just stress the body, they make it harder for your lungs and immune system to keep up. And if you've ever been in the hospital, or if you live in a group setting like a nursing home or assisted living, you're around more people, more germs, and more chances to catch something your body isn't ready to fight off. Now, if that were all, it would be enough to explain the risk. But there's more. Your lungs themselves change with time. The muscles that help you breathe, they get weaker. The cilia, those tiny hair-like fibers that sweep mucus and bacteria out of the lungs, they slow down. And the ability to cough forcefully, the thing that helps clear your airways when something goes wrong, that weakens too. So it's not just your immune system, it's the whole respiratory defense system slowing down. And that's why something as common as the flu, or even a mild cold, can settle into the lungs and turn into pneumonia, often before anyone realizes what's happening. Here's the part that surprises most people. In older adults, pneumonia often doesn't look like pneumonia. You might not have a cough. You might not have a fever. You might not feel sick. Not at first. Instead, you might feel confused, foggy, more tired than usual. Maybe your appetite drops, or you start to breathe faster, even when you're resting. Some people notice their heart racing. Some feel dizzy. Others just feel off. That's because the infection is working under the surface, changing how your body functions before the classic symptoms show up. And when those subtle signs are missed, the infection keeps spreading, leading to serious complications like fluid buildup in the lungs, respiratory failure, or even a full-body infection. That's why knowing these signs and watching for changes, even small ones, matters so much. If you or someone you love suddenly becomes more tired than usual, more confused, starts breathing quickly, or just feels different without an obvious cause, don't wait. It could be a urinary tract infection. It could be dehydration, but it could also be pneumonia. And with early treatment, recovery is far more likely. Now, while recognizing the symptoms is key, prevention is the bigger goal. Because the best time to deal with pneumonia is before it ever starts. And that begins with giving your body what it needs to stay strong. What you eat, how you hydrate, how you move, and yes, what you do to actively support your lungs and immune system. Pneumonia doesn't happen all at once. It builds, slowly, quietly. Sometimes after a cold, sometimes after the flu, sometimes for no clear reason at all. But the process is always the same. The air you breathe brings in more than just oxygen. Every day, you inhale tiny bits of dust, bacteria, and viruses. Usually, your body clears them out without you even noticing. Your nose filters. Your throat traps. Your lungs sweep. Your immune system steps in if something gets past the first line of defense. But when the system is slowed, like it is in older age, these particles have a better chance of slipping through. And when they reach the lungs, they can settle into the smallest air sacs, the alveoli. These are the parts of the lung that are supposed to hold air. Instead, they begin to fill with fluid. That fluid carries white blood cells. It brings inflammation. It makes the lung tissue heavier, stiffer, less able to expand and absorb oxygen. Breathing becomes harder. Oxygen drops. Energy crashes. And if the infection isn't stopped, the lungs can begin to fail. This is why pneumonia can be so dangerous in older adults. Not because the infection itself is stronger, but because the body's response is slower. The early symptoms are often missed, and by the time it's taken seriously, the damage may already be done. But there's another layer to this that many people don't realize. Sometimes pneumonia doesn't come from the outside. It comes from within. It happens when food, water, or even saliva goes down the wrong way. Not into the stomach, but into the lungs. This is called aspiration. And as swallowing muscles weaken with age, this kind of pneumonia becomes more common, especially in people who've had strokes, neurological conditions, or difficulty eating and drinking. This form of pneumonia is especially dangerous because it often goes unnoticed. There's no cough, no chest pain, just a slow drop in energy, a sudden fogginess, a quiet struggle to breathe. And once bacteria from the mouth or throat reach the lungs, the infection spreads quickly. It can turn into a lung abscess or cause fluid to build around the lungs, compressing them even more. In some cases, it enters the bloodstream, leading to sepsis. This is why doctors take pneumonia so seriously. It's not just a bad cold. It's not just something you recover from in a few days. In older adults, it can lead to hospitalization, mechanical ventilation, even long-term weakness or permanent damage. But knowledge is power. And there's power in prevention. The body wants to heal. It wants to protect itself. But it needs help, especially after 60. It needs hydration to keep the lungs moist and mucus thin. It needs gentle movement to keep the chest open and the blood flowing. And it needs the right foods, the kind that feed the immune system, lower inflammation, and help the lungs stay clear. That's the piece most people forget. We talk about flu shots. We talk about medication. But we don't talk enough about how food supports lung health, or how it might be quietly weakening it if we're not careful. The lungs don't just need medicine when things go wrong. They need nourishment when everything feels right, so they stay that way. If you've made it this far, then you already know how pneumonia works, how it sneaks in, how it makes breathing harder, and how it takes a bigger toll on older adults. But what may surprise you is this: what you eat every day could either strengthen your lungs or make them more vulnerable. The food on your plate doesn't just feed your muscles or your brain. It feeds your immune system. It fuels your ability to heal. And it affects the way your lungs fight off infection, clear mucus, and recover from inflammation. When you're over 60, nutrition becomes more than a lifestyle. It becomes a form of protection. Let's talk about what that looks like. Start with protein. Your body uses it to repair tissues, including the delicate lining of the lungs. If you're not eating enough protein, healing slows down. And if you're recovering from pneumonia or trying to avoid it, that protein matters even more. Good choices include soft-cooked eggs, lentils, skinless poultry, tofu, or Greek yogurt. Anything that gives you the nutrients without weighing you down. Then there's hydration. You've probably heard it 1,000 times, but it's worth repeating. Water helps your body thin mucus and keep your airways clear. Dry lungs are sticky lungs, and sticky lungs trap bacteria. Sipping warm water, herbal teas, and brothy soups throughout the day makes a difference. Cold water is fine, but warmth soothes and supports the lungs even more. Now, think about antioxidants. These are the compounds that fight off damage from inflammation, pollution, even aging itself. They come from foods rich in color. Deep greens, bright oranges, rich blues and purples. Spinach, kale, sweet potatoes, blueberries, bell peppers. These aren't just for your heart or brain. They help protect the lungs from the inside out. Then there's vitamin C. Everyone knows it supports immunity, but it also helps reduce lung inflammation and supports your ability to fight off viruses that could lead to pneumonia. You can get it from citrus fruits, yes, but also from strawberries, kiwi, and red cabbage. And don't forget vitamin D. Many older adults are deficient in it, and studies have shown that low vitamin D levels are linked to a higher risk of respiratory infections. The best sources? Sunshine, salmon, fortified milks, and, if needed, a supplement your doctor recommends. Now, let's talk about what to limit. Sugar. Refined sugar weakens immune function. It feeds inflammation, and it often displaces the nutrient-dense foods your body actually needs. Processed foods, soda, pastries. These may feel comforting, but they don't protect you. And after 60, your body doesn't recover from their effects as easily. Another one to watch. Excess alcohol. Alcohol suppresses your immune system and dehydrates your body. That's a dangerous mix when your lungs need all the support they can get. And finally, Don't forget how food connects to everything else. If you're not eating regularly, if you're skipping meals, if chewing is uncomfortable, or you feel too tired to cook, that's something to take seriously. Sometimes pneumonia risk rises simply because older adults aren't getting the nourishment their bodies need to fight off infection in the first place. So if you're feeling weaker than usual, if your appetite has dropped, if you've lost weight without meaning to, it's okay to ask for help. A dietitian, a family member, a community program, anyone who can help you rebuild strength through food. Gently, safely, consistently. Because here's the truth. You don't have to overhaul your whole diet overnight. But small changes, added over time, can create big protection. A warm bowl of soup, a daily glass of water, a little sunshine, and a few meals built around color, protein, and calm. That's not a diet. That's support. That's what your lungs need now. That's what your body's been asking for. And when you give your body that kind of care, you're not just preventing pneumonia. You're helping yourself feel stronger, steadier, and more protected every single day.